Okay, everybody, we're going to get started today. This is our third week covering the COVID-19. So we will be going through some new updates that occurred this week. And as always, things are changing rapidly, so there may be a few things that have changed even since this presentation was made. But let's go ahead and get started. Okay, so first topic, we're going to go over industry updates. So on our last few webinars, we discussed Medicaid waivers. On the last webinar, there were 38 states. Currently, there are 45 that have been approved with the Medicaid waivers. So some examples of those waivers include temporarily suspending prior authorization requirements, extending existing authorization for services throughout the end of the public health emergency, modifying certain timeline requirements for state fair hearings and appeals, relax provider enrollment requirements to allow states to more quickly enroll out-of-state patients for care, relax the public notice and submission deadlines for certain COVID-19 focused Medicaid state plan amendments. So almost all 50 states are covered under these waivers at this time, and probably by next week there's a chance that all states may be under, but we'll see and keep you updated. Okay, the next topic that we are going to discuss today is in regards to MIPS Extreme and Uncontrollable Circumstances Policy. So if you attest to MIPS, you are probably aware that the submission deadline has been extended from the end of March to now it's April 30th. If you don't submit by then, an automatic extreme and uncontrollable circumstance policy will be applied and you will receive a neutral payment adjustment. We still recommend submitting to report and receive your highest payment, because if you submit, you're just going to get a neutral adjustment, but if you submit, there is a chance you could receive, positive reimbursements. So you can check your status on the QPP website to confirm that that has automatically been applied if you haven't already submitted your attestation. Okay, now on to CMS boosts Medicare Advantage and Part D rates. So for 2020, CMS expects the underlying coding trend to increase risk scores on average by 3.3%. Rebasing and repricing impacts is dependent on finalization of average geographic adjustment index. CMS is finalizing implementation of the alternative payment condition count model that includes additional condition categories for pressure ulcers and dementia. And for 2020, CMS is finalizing the proposal to apply a coding pattern adjustment of 5.9%, which is also the minimum adjustment for coding pattern differences required by the statute. For more information, you can find that on the CMS website. Okay, now on to Medicare coverage for the uninsured. So costs for uninsured care are rapidly rising with the COVID-19 pandemic, and layoffs are causing loss of coverage and are intensifying the situation. So if you were previously employed and had insurance, you will be covered. If you were uninsured and have been seen by a provider you're actually covered for issues related to COVID-19. So I'm sorry, I meant to say if you were uninsured and you have been uninsured, your health issues related to COVID-19 will be covered. The providers will be paid at the Medicare reimbursement rate, and they can't balance bill the patient. So all payments need to be written off. Okay, on to the next one, hospital flexibility with COVID-19. So there are a lot of topics that we're going to discuss here. So the first one that we're going to get into is the off-site patient screening. So CMS is waiving the enforcement of Section 1867A of the Social Security Act. This allows hospitals, psychiatric hospitals, and critical access hospitals to screen patients at a location off-site from the hospital campus to prevent the spread of COVID-19, so long as it's not inconsistent with the state's emergency preparedness or pandemic plan. The next topic is patients over paperwork. So CMS is waiving certain specific paperwork requirements. This allows hospitals to establish COVID-specific areas for verbal orders. CMS is waiving the requirements of 42 CFR to allow for additional flexibilities related to verbal orders where readback verification is still required, but authentication may occur later than 48 hours. Expansion sites. This waiver allows hospitals to change their status of their current provider-based department locations to the extent necessary to address the needs of the hospital patients as part of the state or local pandemic plan. In critical access, length of stay requirements and rural location limits have been waived. CMS is waiving the Medicare requirements that critical access hospitals limit the number of beds to 25 and that length of stay to be limited to 96 hours under the Medicare conditions of participation regarding the number of beds and length of stay at 42. For more information on those topics, can be found on the website on the screen. Okay. Hospitals Without Walls does also go along with the hospital flexibility with COVID-19. So Hospitals Without Walls is they can provide hospital services and other healthcare facilities and sites that are not considered to be a part of a healthcare facility or set up temporary expansion sites. Hospitals would still be expected to control and oversee the services provided at an alternative location, and the ASCs that wish to enroll to receive temporary billing privileges as a hospital should call the COVID-19 provider enrollment hotline to reach the contractor services that serves their jurisdiction. So ambulatory centers, mental health centers, things like that, are currently being hospitals are extending their services to locations like that. Okay, because some locations are running out of rooms in the hospital, so they're using other facilities. Okay, now on to telehealth. So I'm sure a lot of you, or probably all of you on the call, are now treating your patients primarily with telehealth. Of course, sometimes face-to-face visits are needed, but many physicians are now completing telehealth visits. Some updates related to telehealth and telemedicine is that CMS will now pay for more than 80 additional telehealth services. So some additional services have been added, like neonatal care, physical therapy, group therapy. They are now included in telehealth and will be reimbursed by Medicare. New billing codes and guidelines have been enacted, and if you would like to see more information on those, that is also listed on the CMS website. Okay, moving on to loans. So there are a few loans that have been released with the COVID-19 pandemic. The first one that we're going to talk about today is the Paycheck Protection Loan. So this is a small business loan. So this is open to all small businesses with 500 or fewer employees. You can be paid retroactive to February 15th, and it currently runs through June 30th. Processing began on April 3rd, and it will cover 2.5 times your average monthly payroll, up to $10 million. So as long as you don't let anybody go, you don't have to repay this. These loans will be forgiven if they're used for payroll, mortgage, rent, things like that. Okay, the other loan that we have is the economic injury disaster loan. So this loan is up to $2 million with 30-year repayment terms. So this one does have to be repaid. That's one of the primary differences. There are no prepayment penalties. It's currently available in all 50 states. The time and business requirement is waived as long as the business was in operation January 30th, 2020. It is also available is a grant that makes it possible for any business meeting the minimum requirements to apply and receive $10,000 almost immediately. And this must be used for payroll. It cannot be used for business expansion, paying off debt, things like that. It can only be used for payroll, utilities, vendor bills. Okay. Moving on to the advanced accelerated Medicare payments. So CMS recently announced advanced accelerated payments for Part A providers. So to qualify for this, the providers or suppliers must have billed Medicare for claims within 180 days immediately prior to the date of signature on the provider or supplier's request form. They must not be in bankruptcy, and they must not be under active medical review or program integrity investigation. They must also not have any outstanding delinquent Medicare overpayments. So we can help you with this in one of two ways. So there is a pretty large form that needs to be filled out in order to apply for this. It requires amount of payment, processing time, repayment. There's many things that need to be included on the form, like the provider or supplier's legal or business name, the address, NPIs, the amount of money you're requesting, your reason for the request, signatures, and many other things. But if you feel comfortable with filling out the form yourself, we can provide you written instructions for the entire process. That is completely free of service. We can send you that if you would like. But we could also take care of the entire process for you. So if that sounds like something that you would be interested in, we can also assist with that. So we would help determine the best 90-day window. We would also assist with collecting data, and we would help you fill out the application and send the application in. And those services would be billed on an hourly basis. So one of the key points there is determining the best 90-day window. These need to be paid back. So applying for it, the time that you apply for it is really important. So as far as repayment goes, CMS has extended the repayment of these accelerated or advanced payments to begin 120 days after the date of issuance of the payment. The repayment timeline is broken out by provider type. Children's hospitals, certain cancer hospitals, critical access hospitals have up to 1 year from the date of the accelerated payment to repay the balance. All other Part A and Part B suppliers will have 210 days from the date of the accelerated or advanced payment to repay the balance. So timing is key if this is something that you think you would want for your doctor's office. Okay, and we are offering complimentary COVID-19 tools. So we have 3 things that we're offering. We have a template and a document that work with each other, and then we also have a CRISA report. So the CRISA report generates a list of your most at-risk patients for the coronavirus based off the patient's chronic conditions. It can be used for patient outreach to ensure that your most at-risk patients are receiving appropriate care. I have a couple practices I'm working with now have been generating these reports and calling their patients to follow up and, make sure that they're doing everything that they need to do to be safe with the times that we're currently in. The other tools that we offer, as I mentioned, are the template and document. So the template and corresponding document will walk your providers through the process of handling a potential coronavirus case. So it screens for other potential causes of the patient's symptoms. So it will ask if they've been tested for the flu or pneumonia, maybe if they've had the flu shot or the pneumonia vaccine. It also allows the users to notify different users of the case and provides the ability to document specific actions and details concerning the case. So if somebody has been in contact with the patient, you can document who the patient was in contact with. Were they wearing a mask when they came into the facility? Has their room been sanitized? Were they tested for coronavirus? Was it positive or negative? So it does put a little alert on the patient's chart, and tasks can be sent to staff members. So these tools are complimentary if you would like them. Okay, and that is all that we have for today. So on my screen, you'll currently see all the resources where we received our information for today's Insights meeting. And if you would like any additional information from me regarding telehealth questions, our complimentary COVID-19 tools, if you would like assistance on Medicare accelerated payments, or any type of the loans that we covered, any questions related to things that were covered on today's Insights, please feel free to send me an email at lauren.pacone@careoptimize.com or info@careoptimize.com. And that's all we have for today. And thank you for joining, and hopefully we'll talk to you next week.